Howdy, and today we're going to diagnose Marlin the clownfish from Disney's Finding Nemo. Finding Nemo is about a clownfish named Marlin who loses his wife and his children in a horrible shark attack. Following the attack, he realizes that one egg is left over, which he names Nemo. After the attack, Marlin can be diagnosed with post-traumatic stress disorder, or PTSD for short. Post-traumatic stress disorder is in the DSVM category of trauma and stressor-related disorders. It is a common disorder among combat veterans, victims of abuse, assault, and rape, just to name a few. PTSD is commonly diagnosed after one has personally experienced, witnessed a near-death situation, or been involved in a violent or traumatic experience. Some stressors and triggers of PTSD are memories, people, places, and activities, just to name a few. It is very common that those diagnosed with PTSD will avoid stressors and triggers of the event. Some symptoms of PTSD are distressing memories, dissociative dreams, flashbacks, and intense psychological distress. Mood alterations are the inability to remember specific parts of the experience, negative belief about themselves and the world, distorted cognitions about the causes or consequences, making the victim think that it's their fault and cause them to blame themselves, and the inability to experience happiness or be in a constant negative emotional state. Alteration in arousal may lead to irritable behavior, angry outbursts, reckless or destructive behavior, hypervigilance, and exaggerated startle responses. In Marlin the clownfish, he displays two symptoms very commonly. The first being negative beliefs about the world, or more specifically in his case, about the ocean. He believes that the ocean is unsafe for any fish, and more specifically, it's very unsafe for his son, who has a slight physical deficiency with a bad fin. His son is taken in the beginning of the movie to the drop-off, which just so happens to be where his wife and children were killed. Marlin then states, "Why don't we just fry them now and serve them up with chips?" showing that he really does not believe the ocean is safe for anybody, but more specifically his child in this case. The second are his altered cognitions regarding the causes of the event. Marlin blames himself for the loss of his family. He believes that because he moved them to drop off, that it is his fault that they died and are no longer with him. One symptom not present in Marlin is the lack of reckless or self-directed behavior. He does not really put himself into any dangerous or bad situations, but along with that, he does not put himself into any good ones either. He is so cautious that he does not really go out and do anything unless he is forced to do so. Treatment for Marlin would involve a therapist using cognitive behavioral therapy, or CBT for short. The long-term goal for Marlin would be his ability to identify thoughts about the world and what is making him feel afraid or upset. He would then learn to replace these bad thoughts and be with more accurate and less distressing ones. He will also learn ways to cope with his anger, his guilt, and his fear, and this will help him to accept what has happened and be more open to people and experiences. This treatment is appropriate because it is the victim who is doing the work. He is being guided by the therapist and is working through things on his own instead of just being told what is right and being fed pills. Some ethical considerations to be taken are that CPT and the therapist could use his power to take advantage of the victim and could lead the patient down the wrong road instead of helping him by doing more harm than good. Overall, Marlin does show us what a textbook case of PTSD may look like. However, if one does not have any knowledge or any experience with the disorder, they may not be able to understand exactly what a lot of it means. Two symptoms that are not seen through Marlin that are actually very common, that people believe to be very common, are flashbacks and reoccurring dreams regarding the traumatic experience. Overall, the portrayal of disorders in films can increase and spread knowledge of a disorder. It can also give a completely wrong impression of a disorder and make those who suffer from it seem far worse off than they may really be. PTSD is just one of those examples where many people believe that they may become angry over small things. However, this is not always true. Overall, while not perfect, Marlin does show us what a lot of the symptoms of PTSD may look like in somebody diagnosed with the disorder. So it's a good movie to use as an example. So thanks. Have a nice day.